Sickle cell anemia is actually a disorder of the blood in which people that have that disorder, their blood actually form what we call sickle. The sickle cell, the red cells actually sickle, and then it blocks the passage of the blood vessels. So that's what usually give them those kind of symptoms that they experience. Usually the bone pains that usually have, and then the shortage of blood because of red cell destruction in the body. So basically, it's a disorder, that one actually inherits from the parent, So that means one of the parents or both of the parents actually have to have, the gene, for the offspring or the child to now, be affected by sickle cell anemia. There are many hemoglobin types actually. The common one the one we are talking about today is about sickle cell, which is the hemoglobin S. So that means somebody that has sickle cell anemia has to have 2 copies now of the hemoglobin S gene. Then of course, the normal adult hemoglobin, we call it hemoglobin A. So people that are AA, we actually have 2 copies of the hemoglobin A gene. Then of course, there's also hemoglobin C. So I'm sure you must have heard people say hemoglobin A, hemoglobin AC, hemoglobin SC, you understand? There's also hemoglobin D, there's hemoglobin E, there's hemoglobin O, there's G. So there are actually many variant hemoglobins that are available. But of course, the ones that are common, that are particularly cause, disorders of hemoglobin synthesis, so to speak, are the ones that probably maybe the S and the SC. S and C. And of course, we are talking about the hemoglobin S today, particularly. Okay, I think it's because of how the disorder manifests, you understand? It manifests way as far back as, let's just say, maybe in early infancy or in childhood. You see someone 6 months, 8 months old being diagnosed with sickle cell anemia. And of course, it's terrible because you see your loved ones, in pain, always in the hospital at every point in time, maybe every month, every 2 months. They have to be giving blood transfusion, they have to be giving antibiotics, they have to do one form of treatment or the other. So I'm sure, that kind of puts an emotional strain on friends and family as well too. So anytime that anybody hears about anybody having, sickle cell anemia, yes, they tend to be kind of emotional about it. And of course, before now, with the advent of medicine anyways, you see that, okay, most of them actually survive till adulthood. But it's also a major cause of people that have some organ damage. And even some of them die, even when they are still, in their young age. So it's something that is quite serious, and I think that's the reason why most people actually, it puts them on the edge when they talk about sickle cell anemia, or when they know or they have a friend or a relative or a family member that has sickle cell anemia. I think awareness plays a major part, bringing information, to the minds of the society at large. So, but for example, now, if you have the kind of stigmatization, and then the experience of a sickle cell patient or a person living with sickle cell that they have, it's actually varied from physical to emotional, it actually borders, seriously on them. So once somebody has sickle cell, and then of course you expect the person, and probably the person is employed in an establishment. Now, this person is not able to carry out his normal function, you understand? Every time he's sick, the employer thinks probably maybe he's just making excuses. He doesn't want to work, he's lazy, he's stupid, and things like that, you understand? So that can actually be one of the ways, in which stigmatization actually comes. You start calling them lazy, and of course, sometimes because of the habitus, when I mean by habitus, the way they appear physically, some of them look a bit, because of some bone deformities, or that they have suffered because of this crisis that they've been having in children, or in childhood, So it actually gives them one form of deformity or the other, and people might actually take on that to pick on them. So, and of course, even calling them C-class, yes, I think that one is very, very common. That's saying this one is a C-class, that one is a C-class. Is enough stigma as well to that can work or that can make a significant impact on the psyche of someone that is living with sickle cell anemia. So yeah, I think that's probably one of the reasons. I know this question is going to meet me one day. But I wasn't prepared that it's going to meet me today anyways, but I'll try as much as possible to answer the question. Yes, let me say parental influence was one of the good sides for me. I had a very loving mom. Even when I was growing up, I never knew I had this condition. Everything that I needed to be done, she was there for me to do it. So that's why any parent or any couple that have a child with sickle cell anemia, they have to pay special attention on that child. You understand? So I think that's what my mom and my dad actually did for me as well too. So when I was growing up, I basically didn't have much crisis like that, until I lost her. I think when I was age 10 or 11. I think that was when, yes, I started experiencing some of these things. That parental care, that extra care, that I needed, was lost. So yes, I started having the crises and started having all those problems. In fact, when I was younger, I played football with my peers and things like that without any problems, without any crisis and stuff like that. So I got to know myself, to be fully aware when I was about age 10 or 11, that yes, I think I have something that other people do not have. So, and I had to, pay particular attention to myself. Going through secondary school was very, very rough. Of course, I was smaller than my peers. They were 2 times my size and things like that, you understand? One of the complications as well too. Frequently got admitted, during secondary school. Sometimes you have to be transfused with blood. Sometimes you are away for 2 weeks, 1 month. You have lost, some academic, will I say, knowledge now, so to speak. So at the end of the day, of course, it definitely affects your grades and things like that and stuff like that. You understand? But one reason or the other, probably the influence of my father as well too. He was a prayer warrior, anyways. So I think yes, that one's also helped as well too. He was able to help me through the phase of secondary school until I got to university. University was a whole lot of ordeal on its own. I frequently do not fall ill, but sometimes. But I think the one that was the major challenge for me when I was in medical school was when I was in final year. I think it was supposed to be the last of my exams, to qualify as a medical doctor. I had a crisis on that day, and I had to do the exam because I didn't want to do a receipt. You understand? So it was something very, very challenging. It was challenging going to medical school, looking at others, doing what they are doing, and then you aspire to become or to do what they can do, and then you cannot do it because you know that you are just different. You understand? So it's about me learning about myself, knowing my capabilities, knowing my limits, trying not to exceed my limits, and trying not to do things that will make me fall ill. I think basically maybe for me that was what worked for me. And then coming to residency training, that's residency training is is another kettle of fish entirely. It's like 4 times more stressful than going to medical school for me. And for me to be able to have actually reached the pinnacle of my career, I think I owe it to God because He's the giver of life. So yes, I'm very religious, so I have to mention God, Jesus Christ. So I don't think on my own I would have been here by myself. So I think committing my ways to God as well, to leading me in the path, bringing me here this far. I owe it to Him. And like I always counsel other warriors as well too. There's nothing God cannot do. Yes, most of us we have one prayer point. Yes, you want this thing just to change so that you can live your life as like normal people and things like that. But of course, our experiences should be what should be able to motivate others as well too. That if I can do it, definitely you can do better. Not just that you can do it, you can actually do better. So going through medical school, going through residency training, and being here at this point in time, yes, I think yes, it has. I owe it all to God. Well, sickle cell patients, they are actually human beings. You understand? And then I think yes, they deserve to be related with just like every other person. Of course, because of the fact that yes, they will be needing medical intervention at every point in time of their life. You understand? So they should be gainfully employed as well too. You can imagine someone living with sickle cell anemia and then he's not gainfully employed. So anytime he's sick, he needs to be transfused with blood. He needs to get medication. So how do you expect him to get or the person to get money to finance his healthcare? You understand? And even if the person also demands financial will I say help from family members and friends, how often do you expect them to be committed towards helping this person anytime the individual falls sick? You understand? So it's actually something that it makes a significant impact on the social economic status of the person, the financial status of the individual as well as the family members as well too. So it's not just on the individual alone, but also on the members of the family of a person that is living with sickle cell. So you can just imagine if a couple have 2 children or 3 children, which we've seen in a number of times with sickle cell anemia. Both of them can be on admission at the time. All of them can be on admission at the time. And then, of course, this person will not be able to go to work. That is, the couple might not be able to go to work because they still have to stay back, and take care of the children. So you can just imagine they've lost many hours, manpower at work, many hours at work. The finances that is, that they've probably be put into other things in the home is now, diverted towards, the medical treatment of these people. So yes, it's something that is actually quite pertinent that we need to actually look into and also talk about as well too. Yes, it's avoidable, and I'll give my reasons. You said yes. You said something about science says okay, maybe the first child will be EE, and then it states otherwise. I think they are getting the whole thing wrongly. I'm sure students of biology now they will remember Mendelian's theory. You understand? By the time you are doing crossing genes and stuff like that, So when a couple, have hemoglobin S gene, that is maybe let's just say you have 2 couple that are AS, the husband is AS, the wife is also AS, and then by Mendelian law of inheritance, it's actually the risk is actually in each pregnancy. So that 25%, that if you do the crossing, the first one you see AA, and the second one and the third one you see AS, and the last one you see SS, So that last one that is SS, it should be S, that is the 1 out of 4 pregnancies. So that is 25% risk of every pregnancy will turn out to be SS. So we don't know which pregnancy it will be, whether it's the first one, whether it's the 10th one, whether it's the 100th pregnancy. But we know that, yes, those couples can actually have 3 children and all the children can be SS. And they can also have children and then none of them will be SS. It's also possible as well too, you understand? But at the same time too, yes, couples that are AS and AS can get married, yes, fine. But they need to do what we call genetic testing by the time they are pregnant or by the time the woman is carrying the fetus. So they need to go and do DNA testing and then to check whether the baby that they are carrying is going to be SS. Now, it's now going to impact on the couple whether to make the decision whether to terminate the pregnancy or to keep the pregnancy. So you can imagine the emotional stress is going to be on the woman having to terminate each pregnancy that she has because of the fact that okay, she kept on having a baby that is SS, a baby that is SS, and of course doing those tests too, they are not cost effective, so to speak. So, better to avoid, such match, so to speak. You understand, and then save oneself of the emotional stress and trauma that might be associated with recurrent termination of pregnancy when they have a baby that is sickle cell. I think the way the diagnosis was made for the so-called genotype, actually we call it hemoglobin phenotype or hemoglobin electrophoresis pattern, not really genotype in actual sense. So I will use the word phenotype instead of genotype, please. So if the where they had gone to do the phenotypic testing, so to speak, and then they have been given the results that is AA or both of them are AA, then of course much has to be considered or much has to be investigated when it comes to the laboratory itself that is making such diagnosis. We know that yes, in Nigeria right now there's really no law or there's really no a test, a definitive test, so to speak, that needs to be done to confirm diagnosis. We have not yet gone there, or we have not yet arrived at making policies towards making diagnosis for, phenotype now, hemoglobin phenotype, so to speak. So, in such instances, I will recommend that anybody that wants to do a hemoglobin phenotype should actually do it in a government-approved hospital, preferably a teaching hospital, where they have hematologists, medical lab scientists, and people that are well-skilled in making such diagnosis. So, having said that, there is also another condition as well too that mimics sickle cell, so to speak, and we call it thalassemias. So, a lot of people too, you understand, they come and they say they are AA, you understand, but on the test strip, so to speak, you only see one band of A, so you don't know whether it's 1 or 2, you understand, because if you are the same clone, you should look alike. So that's what I'm trying to explain. So sometimes it can just be only one, and then the other one is absent, and that's what we call thalassemia, when the accompanying gene, so to speak, is absent. So someone that should be AA should have 2 copies of adult hemoglobin A, but this person is now having 1 copy, and then the other copy is absent. So peradventure that person marries someone that is AS now, definitely they will have a child that will have S, and then the accompanying hemoglobin gene, which is supposed to be A now, is now absent. and then it will like S not, so to speak. So that person has an HBS beta thalassemia, and the person will come down with sickle cell anemia. It's something that we have seen, in our years of practice. Yes, it happens a lot as well too. So thalassemia is also another confounding condition, that is making, all these rounds, all these narratives, so to speak, go around. Yes, and of course, it also has to be, investigated as well too, such that once you are making a diagnosis of your genotype or your phenotype, so to speak, I think that's the appropriate word. You should also look at, whether the person has a thalassemic trait or not. And I think once we have gotten to that level in Nigeria, we should be able to reduce, the prevalence of couples having babies with sickle cell anemia. Once someone is AS, there's a ratio in which the person has a normal hemoglobin, normal adult hemoglobin, which is hemoglobin A, and also, of course, the hemoglobin S as well too. You expect it to be 50-50, yes, to buffer, the effect of the hemoglobin S. But sometimes the ratio can actually, change, and the person might have hemoglobin A of maybe 30% and hemoglobin S of 70%. Something that can be done when the person does a test that we refer to as a high-performance lipid chromatography. It quantifies the hemoglobin. So AS that usually have crisis, they must have also exposed themselves to some very, very stressful or strenuous conditions. Particularly, that's why people that are AS cannot actually be pilots, because by the time they go to that altitude, you understand, the body will be deficient of oxygen, and then the sickle hemoglobin that they have as well, can actually form the sickle crystals and then block their blood vessels, and then they start having some pains, and then even some bone pains and things like that, you understand. So it's also possible that they can also have a form of crisis as well too. If they are exposed to stringent or extreme of conditions, yes, AS can also experience crisis like sickle cell. Sickle cell anemia is actually a genetic disorder, like I said, you understand. So for someone to have sickle cell anemia, that means the person must have inherited it from the parents. So if there's something we refer to as genetic polymorphism, you understand, it actually borders on, you doing the DNA and then looking at the segments of the hemoglobin S gene and things like that, and find out factors or the reason why one person will have a severe disease than the other. Yes, there's something we refer to as hemoglobin haplotype. So if the person has actually, has inherited maybe one of the most severe hemoglobin S haplotypes, particularly with the Bantu, the one that is found in Central African Republic, you understand, actually those ones are quite severe. So probably, maybe, it's just hypothetical now, so I'm not stating categorically as a specialist that maybe that's the reason why or not. But we know that sometimes some sickle cell patients have a milder disease than the others, and it also borders on haplotypes and genetic polymorphism. So I think that might explain it. There are many patients, sickle cell anemia, females, yes, they get pregnant and then they have their delivery, fine and good. But the only thing that we advise is that once they want to get their delivery, they should have it with a specialist. An obstetrician, a gynecologist must be involved in that situation, you understand, such that if there's going to be any complication, it will be averted before it happens. So yes, they can have normal delivery. Why not? No problems with them. Except if there's any other complication that they have, that is going to prevent a normal delivery. And then, of course, they might have to maybe undergo surgery or the like. But yes, a lot of them actually undergo normal delivery without any problems. So far, they are in the right hands, and then every avenue of every complication arising is actually blocked. Yes, so they do well. I don't think there's a relationship between blood group and immunity. Well, at least from my own knowledge or from my own understanding. So I'm not speaking for the medical world generally. One thing I can say is that, like I said earlier, some sickle cell patients usually have less frequent crises than the others. And I said something about haplotypes, genetic polymorphism. Sometimes, just like some of them have thalassemia as well too, you understand, that can actually help them, have a less form of the disease. Sometimes some of them actually have what we refer to as a persistent fetal hemoglobin. That is the hemoglobin that is present in newborns until the age of 4 to 6 months, you understand. For sickle cell anemia patient, for some reason or the other that we don't know, or that is being investigated now in the medical world, they tend to keep that hemoglobin, and that hemoglobin actually helps them a lot because it improves, oxygen delivery at the tissue level, so that when they are exposed to a lot of stress and conditions in which there's poor oxygen delivery to the body, the fetal hemoglobin comes through and helps them, and it prevents that sickling at that level. and then of course they tend to have less form of crisis, and of course the less form of disease. Yes, so maybe in that sense, yes, because some of them have high hemoglobin, yeah, they have less severe form of the disease, except in the fact that if the person or the person that has a sickle cell anemia patient has a very, very rare blood group. For example, now people that are rhesus negative, or Rh negative rather, sometimes looking for blood that is Rh negative can actually be very, very tasking. So except that, but apart from that, they can have their normal life without any blood group interfering with with their lifestyle, so to speak. But sometimes if they have a rare blood group and they need blood, yes, it might pose a major challenge. Yes, I think in that aspect we can say it can also be to some extent affect their management or their treatment. Currently, I think the oldest person that has sickle cell anemia that we know in Nigeria, I think the person is about 91 years or something. I'm not sure whether she's still alive or so, But even the one that I have seen in my practice now, I think the person is about 60 years. So what should we say about those people as well too? So I think now, even with the advent of improved medical care, yeah, they can live their life to the fullest. You understand? I once had someone, that actually taught me in medical school. The person's father was never diagnosed until age 70, and the man was a farmer all his life. So there are a lot of things, that actually that actually happens. But giving them or just pegging an age limit on sickle cell anemia patient and say they will live to this age, and I don't think that is true. Probably maybe it's what they experienced, that maybe they know, or they have someone that got to that age and died. A lot of them can actually live normal healthy lives to their adulthood, and there are no issues. I'm Dr. Adeyemi Olusegun Ayobola. I'm a medical doctor, obviously, and I'm also a hematologist, and I'm a person living with sickle cell anemia. Sickle cell anemia itself, it's manageable, it's treatable, and it's also avoidable. My advice to intending couples is that once you want to know what your hemoglobin phenotype is, go to a government-approved hospital. Make sure it is a tertiary hospital, a tertiary institution, so that you are sure of your results. And then in couples that are already, will I say discordant now, maybe they are already carriers of the condition, all hope is not lost. If you have a child already that is sickle cell anemia, I think you just need, to pay particular attention and then give optimal care to the child. Of course, the child can become anything that he wants to become. I'm a medical doctor today. I'm a hematologist today. So I will not really condemn any any patient living with sickle cell anemia. Just give them, the adequate avenue for them to be able to express themselves and to become who they want to become in life.